for your patience. Here we are. Second stage and third stage labor. Contractions can start back up, further apart, and as about 1 minute long. So that can happen. Mother will feel she is coming back alive and alert. She gets the hormones and she starts feeling like she has the energy to push. She's rejuvenated in second stage for her pushing. Deep breathe with her. No need to count contractions or pushing. No need to direct pushing whatsoever. Let her push and you take the lead from the mother. No need to count contractions. Yes, let her choose the position for delivery. Avoid having her lie flat on her back. It's harder and not a natural position. Some good positions are hands and knees, kneeling by bed or chair, downward dog, moving lunge, supported squat and knees, or supported squat or hands and knees, and then sitting back with a propped up in a semi-reclining position is another one. Some good positions if baby is having a hard time coming out are McRoberts, which is both knees up beside the ears. You can do that on your front, on your back, or standing up if you have enough support. All three can be really good. Brazilian squat and supported squat, yes, and especially with elevating the front foot if you're doing a seesaw motion with a running start, that can be a really good one too. And modified McRoberts is McRoberts on your front. Now, here's a couple of things to remember about second stage. Do not pull, twist, or tug on the head. You are stretching beautifully is a nice thing to say to the mother. She's very suggestible, so you can tell her, your tissues are stretching beautifully. And warm and hot compresses go a long way. They can be really nice to have on the perineum. You can get a crock pot and take the cloths out, make sure they're not too hot, test them on your inner wrist before putting them on the mom's perineum. And then just holding those cloths on her perineum can really, really help mom to relax and know where to push, okay? And for her tissues to be calm and relaxed. So we have used them many times. Birth is the end of second stage. The body will know when to take breaks. Let mom guide the baby out. There's no time limit, no rush. Keep the hormonal cocktail high by keeping the energy smooth, grounded, and low in a safe, secure, comfortable, nurturing way for mama and her family, who's ever there, her husband or her partner, who's ever there with her. So they're like a unit, and you can nurture that bond between them, and that'll help the hormonal cocktail stay high also. There should be almost no blood at the delivery itself, but with the placenta, there should be a gush of blood, sometimes around 1/4 cup. And that's a sign that the placenta has detached and is just waiting to come out. And getting mom up and using gravity can really be helpful. Let mom do what she feels like. Find the baby for skin to skin. Unless it's cold, then put the baby right on mama's skin, dry them both off, and put blankets on the outside, keeping mom and baby undressed except for a diaper on the baby. Because the skin to skin regulates the baby's body temperature and all body systems, including respirations, digestion, and the skin also colonizes the baby's gut, which is sterile at the time of birth. And so that good bacteria comes off the mother's skin. Not bathing the baby for several days after birth can be also a very good protocol for encouraging good bacterial flora colonization in the baby's gut. So let mom do her own discovering of the baby, bringing the baby up if it's not too chilly, but make sure baby's dry, mama's dry, and they're warm and safe together, and no one separates mama and baby. Keep cord attached. The placenta has 40% of the newborn's blood supply and stem cells in it at the time of the delivery, which takes 10 to 15 minutes or longer to pump into the baby, so leave the cord pulsating. It's also unsafe to cut it in an out of hospital, low resource, unexpected setting. Best to leave it and it will fall off within 3 to 5 days. Keep it in a Ziploc bag and wrap it near the baby. So wipe off the baby with a cloth and cover the baby and keep them quiet and safe and private. Allow the body to relax and be ready for the placental delivery, and that's stage 3. So I'm just gonna, okay, we'll